Come on, sit down. Hi, Jennifer.
Hi, good morning.
So we have Jennifer Morales and
Dr. Nuñez.
Dr. Nuñez, and they are from Tampa General Hospital. So I'm guessing that Maria sent you guys.
Yes, she did.
Awesome,
Yes,
great.
love
we love Maria.
Maria.
So
She's
Ralph is in full sun. So look, you guys introduce yourself and what your role is with TGH.
Absolutely. My name is Jennifer Morales, and I am the Director of Business Development for Tampa General Rehabilitation Hospital.
And my name is Dr. Rigoberto Nuñez. I'm the Chief of PM&R at Tampa General Hospital.
Awesome. And so you're at this conference, which is a very big conference. What are you looking forward to doing here?
The opportunity to network and learn about other strategies and technologies that we can use for our patients to improve their quality of life.
Very nice. And I think there's a luncheon this afternoon at noon.
Yes, at noon.
Awesome. And so what is that all about? Tell us about that.
Opportunity to meet one-on-one with workers' comp representatives from across the country and to explain the continuum of care that Tampa General offers their
Very
employees.
good. Very good. So thanks for agreeing to be on our podcast. We appreciate folks coming and talking with us. So tell us more. Tell us more about what are some of the challenges you guys are seeing at Tampa General Hospital, your program, and what you're doing there.
But one thing that we're focusing on is really trying to capture the injured worker from the moment of injury until they're able to return to work safely. So that's really big, a big initiative for our system, so that we can ensure quality care throughout the whole process.
Very good. And we love Maria. She's been so hard at work transforming the program over there at Tampa General Hospital. We think she's done an amazing job. So what else? Tell us something unique about the Tampa General Hospital program.
I think one of the most unique things is from the start of the occupational medicine program, where they can go out into the community and they can do the employee health screens, to the time the employee gets injured, whether it's going to an urgent care center or through the ER. Then they're getting admitted to the hospital, continuing the care into an inpatient rehab setting, getting them out of the inpatient rehab setting into the outpatient rehab setting, back home and back to work.
Wonderful.
To have the multidisciplinary team that is working on every aspect of the patient's life, from psychosocial to the physical to the medicine.
We're also very used to dealing with catastrophic injuries. We have a lot of specialty trained physicians and therapists. So very severe catastrophic injuries like brain injuries or spinal cord injuries are something we're very used to dealing with. So we can treat obviously minor injuries, but we're really specialized to train the catastrophic ones as well.
That's wonderful. So tell us about, this is something that I'm fascinated with because I work for Institutes of Health, which is based over in Southern California, and we specialize in catastrophic injuries, not necessarily catastrophic, but the more complex injuries. So PTSD, brain injury, very severe chronic pain, CRPS cases, and things like that. We need more doctors and more specialists in this industry. What would you say is something that would be something that would inspire a doctor or a clinician to consider workers' compensation?
I think we give hope. That is one thing when walking into rehab and out of the acute care setting, and then you walk in and you see people who are going through something similar to you, and to know that that patient might have come in and thinking that their entire life has changed and will never be the same, and then it becomes more similar and the same,
Right.
And now they're back into the community. To give hope to someone it's the biggest blessing.
Well said. I love that. And Doctor, what do you think from your perspective?
I mean, that's hard to top. But one thing that it really provides value to the worker's life is to be able to be productive, especially after a catastrophic injury. It provides meaning to them.
Right.
So I think that to be able to add that back to them after catastrophic injury is really valuable.
I love that. We're always talking about how, we're sort of geeks, Raphael and I, in terms of the workers' compensation industry and system. But I think one of the things that's really wonderful about the workers' compensation system is it is complicated, but therein lies what makes it, I think, so amazing to be part of this system. Is it's a complicated matrix of things that have to happen in order for the right thing to materialize, right? And so it's a challenge. And so for me, that makes it, we're lifelong learners, and we love to always be challenged and inspired to kind of dig in and do the right thing. So I think that's right. And I have to take a moment to do a personal shout out.
Yes.
I have a daughter
Yes.
who has recently graduated as a doctor of physical therapy, and she is starting today as a resident at Tampa General Hospital in the physical therapy department. So I just got goosebumps. I'm so excited.
I did too. I love it.
Her father worked at Tampa General Hospital in the physical therapy department. He was an assistant therapist, and so she was inspired by her dad to go into the profession. And I'm just so happy. I'm going to cry.
Yeah.
I'm just so happy and excited that she's starting at Tampa General. It's kind of been a dream of her dad's for her to do that. And she did her second year clinical at TGH, loved it. And I told her, I said, keep in touch with those folks, because she had a really great experience, and great to the, testament to the great folks at TGH. And so I said, keep in touch with those people and just stay in touch and see what's going on. And she applied for the residency, and now she's got it.
We're both Tampa long-term, residents, so we're big fans of Tampa General. And I mean, in this experience now, watching our baby, if you will, right?
Yep.
Like literally enter the profession through Tampa General. What an amazing thing.
So shout out to my daughter, Roshan
Absolutely.
Helfai.
Congratulations.
She's starting her first day today at Tampa General Hospital. Woo!
Very cool.
Yeah, so the reason I went into that more than just the personal shout out is that I've been hoping secretly that Roshan will make her way into the workers' comp system. So
And I'm so proud of Tampa General, because we have out here noticed the attempt and delivery of improving in that workers' compensation messaging, services. And Doctor, you're absolutely right. The expertise, especially in the catastrophic injury component of things, second to none, right? And the hospital gets ranked, universally now, right? It's a number one in the state and nationally always ranked in this kind of program. So that's fantastic.
yeah, it's noticeable. We were both very sad. You guys had an event. When was it? April, May.
at the Riverside.
And we were supposed to be there, and I ended up getting sick and didn't want to come spread germs, so I stayed away. And anyway, we had been at several events in a row, so we were very sad to miss it. But we see Maria always arranging these wonderful events and being out in the community. It's just awesome.
She's amazing. Dr. Nuñez was there. Our therapy team was there. They demoed the exoskeleton, which is one of the pieces of technology to get patients that are unable to ambulate back to ambulating.
Awesome.
Yeah,
Sorry, we've got full sun on us right now, but
our
go
culture
ahead.
at Temp General is really into educating.
Yeah.
So we educate just like your families being part of the therapy team. We educate workman's compensation patients and staff and all the team members to kind of bring everyone up to the top level so that we can provide the best quality of care possible.
Very good. Well, we're going to have you on for a full episode. So I'll be in touch with Maria. Make sure and leave your card as well so we can talk. But thanks for stopping in to chat with us today. Have a great conference. And I think I'm going to see you later at lunch.
I'll see you at lunch.
Awesome.
Thank you.
All right, take care.